Hi guys, so Wes Streeting, the Shadow Health Secretary, hit out at what he called middle-class lefties. So this is following an interview he gave to The Sun, where he claimed that he would use the private sector to deal with the backlog that exists in the NHS. The future Health Secretary claimed that he was putting practical solutions ahead of outdated ideology. Streeting has been called out before due to his close connection to certain private health companies. Now, while this may seem like a good idea on the surface, there are a few problems with it.
Well, it seems mad to me that we've got spare capacity in the private sector where we're not using it. And you've got a situation today where middle and upper class people who can pay to go private are being seen faster, getting diagnosed more quickly and treated more quickly, which is certainly better for their quality of life, but better for their outcomes. And then working class people are left behind because they're priced out of this two-tier system. Now, what I'm proposing is that a Labour government would use spare capacity in the private sector to bring down waiting lists faster, but no one will have to worry about the bill, and that service would be provided to working class people who otherwise wouldn't be able to access that capacity. But as they would if they walked into an NHS hospital, they will not get hit by a bill. Now, in some ways, I'm not happy about this because I think the NHS should have the staff, the equipment, the technology it needs without relying on the private sector. But I've got to deal with the world as it is after 14 years of Conservative government, not the world as I would wish it to be. And that's why I'm making that punchy argument in The Sun today. I've already had howls of outrage online from lots of middle-class lefties complaining about it, but they're not the ones who are waiting for months and months and months in pain and agony. And they are also the sort of people who quietly and privately would say, well, of course, I had to pay for a scan, or my uncle or sister or brother had to pay for a scan. A lot of people in our country are not in a position to do that. And I would struggle to look someone in the eye and say, I'm sorry, I'm not going to pay via the NHS for you to be seen faster because my principles are more important than your healthcare. So I'm making both a pragmatic argument that the capacity is there, but also a principled argument, which is I'm not prepared to see working class people priced out in this terrible two-tier system the Tories have created. And of course, in the longer term, is Labour's ambition through workforce expansion, doubling the number of scanners, and building on our proud record as a party of making sure that in future, the NHS has the staff, the equipment, and the technology it needs to treat patients on time and to honour that founding principle of the NHS as a public service, free at the point of use, there for us when we need it.
Okay. A few things I have to say about this. So he says that the private sector is going to pick up the slack and help reduce the waiting list. Well, the private sector can't do that because they don't have that type of capacity. We're talking about millions of people, something like 8-9 million people are on the NHS waiting list. The private sector doesn't have the capacity unless it's tinkering around the edges. So the private sector cannot you can't send millions of people to the private sector for treatment. Now, even if they did have massive amounts of spare capacity, which they don't, but even if they did, well, how are you going to fund that? Because you're going to need extra funding. Because the private sector are not going to do it for free. So this is talking about money going to the private sector once again. This is part of the problem with the NHS. Now, when it comes to the funding, is this money that the government are going to set aside? Or is it going to come out of existing NHS budgets, like what happened with the Tories on a number of occasions? What the Tories would do is introduce a new policy, and then it would actually come out of existing NHS funding. It wasn't any new funding, so it was a new policy, but no extra funding. So where's the funding going to come for this? Is there funding put aside for this, or is it going to come out of existing NHS budgets? Now, patients are going to go into the private sector. Well, will they be guaranteed all types of operations, all types of treatments? Because the private sector may say, well, this type of treatment is profitable, we'll take that patient. This one isn't, so we'll reject the patient. So is there a possibility that people will be forced to wait anyway because the private sector is not interested in doing those types of operations? And finally, will the private sector involvement be reduced once things are fixed? Now, he sort of hinted at that towards the end. He said, look, what we're going to do is we're going to invest in the NHS, we're going to buy all the equipment that it needs, we're going to train up the staff. But how long will that take? Is there a date for that? And we know with the private sector As soon as they get their clutches on something, they don't want to let go. If they can see this part of the NHS is profitable, we're not going to give it back to the state. That, they're in the business of making money. If they can find something they can make money off, they're not going to give it up. And they'll lobby, they'll corrupt, they'll do whatever they can to hold on to that business. So while it may seem good in theory, what you do is you use the private sector to get over this block, to get over this problem of the NHS waiting list. And then in an ideal world, the private sector give this work back to the NHS because you have trained up all the staff, you have bought all the equipment, you've upgraded the hospitals, everything, so you can go back to the model you were using before. But there are many stumbling blocks. The NHS doesn't have the staff at the moment. You're going to have to recruit lots of staff. You're going to have to train up lots of people. That costs money. And it seems that the incoming Labour government don't want to spend a huge amount of money. They're not talking about massive investment in the public sector. They're not talking about raising taxes on the richest in society to fund this. They're saying, well, we're going to keep things pretty much as they are. We're going to streamline things. We're going to use technology. We're going to find savings. But this is not going to fix that. And this is not going to bring down the NHS waiting list. Think about it for a moment. If the Tories could, they would be doing this. They see the waiting list increasing. Wouldn't it make sense for the Tories to use the private sector? They're fully on board with using the private sector. So I don't understand how Labour's use of the private sector would somehow magically reduce the waiting list. It would be really useful for the Tories politically to rely on the private sector to bring down the waiting list. But they don't want to do that, or they can't do that. Maybe I'm getting the wrong end of the stick here. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot.